That's my teenage daughter, lying on that stretcher. She's really hurt, and I don't even know how bad. I'm so scared. I know she needs to be here to get help fast. But after all, she's still just a kid.
When an accident occurs or sudden illness strikes, your recovery begins at Nash Healthcare, where a highly qualified staff of physicians and healthcare personnel are ready 24 hours a day to handle any emergency that may arise.
Frances fell off the couch and hit her head. So we got here and we kind of rushed up to the front. There were a lot of other people in the waiting room. I think it was swine flu season. People had on masks, people were coughing. There were a few children here also, but the waiting room was very full.
This year, 60% of all the admissions to the hospital will result from an emergency room visit. It's literally the front door to our hospital. With nearly 65,000 patient visits a year, the emergency department is very frequently the patient's first contact with the Nash Healthcare system, our medical staff, our nurses, and other hospital facilities.
The current emergency department was built in 1993 and was designed to serve a maximum of 40,000 patients annually. Currently, the number of patients using the emergency department has increased to nearly 65,000 patients annually, making it one of the busiest emergency rooms in North Carolina. About 180 patients a day use the emergency department.
20% of those individuals who seek treatment at the Emergency Care Center at Nash General Hospital are age 17 and younger, compared to the national average of 10%. At Nash, this 20% equates to about 36 children daily.
It's definitely 100 times more important with children who don't have the cognitive ability to understand what's going on around them, where everything becomes frightening. The world is a frightening place to a healthy child. Make that child sick, make that child hurting, and things become more amplified.
We were all at the house. Ward was in the living room. He was sitting in his chair, stood up in his chair, turned around, and fell over onto the coffee table.
It was a Friday night. The ER was very busy. It was packed with tons of people. And so we very quickly went up to the admissions desk and really stood there until we were able to be taken back.
Mommy? There needs to be a separate facility for the safety, for the security, and frankly, for the peace of mind of not...
It's hard to put a value on having a good hometown hospital until you need it, you know? But when you need it nearby, and you need it qualified, and need it be ready.
The current emergency department was built in 1993 and was designed to serve a maximum of 40,000 patients annually. Currently, the number of patients using the emergency department has increased to nearly 65,000 patients annually, making it one of the busiest emergency rooms in North Carolina. About 180 patients a day use the emergency department.
20% of those individuals who seek treatment at the Emergency Care Center at Nash General Hospital are age 17 and younger, compared to the national average of 10%. At Nash, this 20% equates to about 36 children daily.
It's definitely 100 times more important with children who don't have the cognitive ability to understand what's going on around them, where everything becomes frightening. The world is a frightening place to a healthy child. Make that child sick, make that child hurting, and things become more amplified.
We were all at the house. Ward was in the living room. He was sitting in his chair, stood up in his chair, turned around, and fell over onto the coffee table.
It was a Friday night. The ER was very busy. It was packed with tons of people. And so we very quickly went up to the admissions desk and really stood there until we were able to be taken back.
Mommy? There needs to be a separate facility for the safety, for the security, and frankly, for the peace of mind of not only the parents involved, but more importantly, the child.
The current physical setup of the emergency department isn't adequate or large enough to handle the increased numbers of patients being treated here. Also, we expect to see a significant increase as a result of the recently passed health reform legislation. So to keep pace with the healthcare needs and expectations of Rocky Mount Nash area residents, it's time for us to move forward with a new and larger emergency care center.
You often hear children are not little adults, and it's true. They're children with their own set of needs. Adults are scary for children, adults that they don't know.
as a pastor, a chaplain, a family member of this community. This is a wonderful opportunity for us to build for our future by building for our children and giving them the care that they need at the time of their life where they need it the most, and a pediatric care unit for our children.
I have been in the emergency room as a mom carrying my young son, as a volunteer working in there, and as a patient myself. I have seen the face of a young child who comes in nervous, not feeling good, afraid, and all of a sudden he sees an adult or someone in there that has been involved in a traffic accident, or hears a patient down in another room yelling because they're in pain. To that little boy or girl, he doesn't know that they're screaming because they're hurt. For all he knows, there's someone in there that is hurting them.
This year we will see about 13,000 children at the emergency department at the Nash Healthcare System. Unfortunately, when these children visit our emergency room, they are exposed to very difficult realities of adult situations. Currently, there is no way to separate these children or protect them from these common emergency room issues.
Our plan, like other initiatives here at Nash, is to improve the quality of health care within this region. That's our mission as a hospital board, and that's what we're committed to.
The plan is to construct a new and larger emergency department with a separate pediatric emergency care center and to provide a new, larger, and consolidated heart center. Staff members and physicians played major roles in the planning for these much-needed facilities.
This, to me, is a quality of life issue. We talk about it so often over the years to address a primary health need of our children, giving them an emergency room for themselves. They are our future. They are what we look to, and I think this will be a wonderful, wonderful addition to quality of life in this community as we move forward.
With progress, there's a price. The new emergency care center will cost an estimated $25 million, including the $3.5 to $4 million cost for the separate pediatric emergency care center.
The Nash Healthcare Foundation Board has accepted the challenge of the new and separate pediatric emergency care center.
And that challenge is to achieve the goal of raising $2.5 million in community support for this important project.
Funds will be raised through two major special events, the Patrons Gala and Golf Classic, as well as the Capital Fundraising Campaign.
My family and our company have been involved in numerous projects throughout our community for many years, just like many of you have been as well. We all know the importance of our own health and the need for a top-notch medical facility in our own community. That is why I have committed to accept the challenge and the opportunity to be the honorary chairman of this capital campaign for the much-needed separate pediatric emergency care center.
An emergency room expressly designed to meet the special needs of young people, infants to age 17, will provide a more comfortable and safer experience for patients, their families, and the doctors and other healthcare professionals who treat them.
The project we will embark on will create a new pediatric emergency room. We will be one of the few hospitals in North Carolina to offer a unique environment where children will be protected from all such situations from the moment they arrive at our hospital campus. They will wait separately, be treated separately, have their own unique radiology and imaging services. We think we owe this to our children.
I'm very excited about the designated wing of the emergency room in this new facility plan. It's going to provide our young adults and children for a safe environment where they can receive the best possible health care.
In the final analysis, this is all about us pulling together to have the best hospital and healthcare system that we can possibly have. I can't think of a better way to impact the lives of every citizen in Rocky Mount and the surrounding area.
We believe that this is a grand start, but it can only be successful if you, who are in the community, come and support such a project as this. And I know you will, because it is for your children.
This is your Nash Healthcare, where life begins, where life is extended through medical science, and where many lives are saved. Your financial pledge to the capital campaign is an investment, making you the giver, a permanent partner in the vital work of Nash Healthcare. Your decision to support the It's All for the Kids capital campaign will be remembered and blessed by and for generations to come.
Thank you! Thank you! Thank you! Thank you! Thank you!
Thank you!
Thank you!